So this station is to look at the equipment and the technique for fetal scalp sampling. So fetal scalp sampling allows you to obtain the fetal pH by directly taking a blood sample from the fetal scalp. And this information can help determine if the baby is acidotic and help guide further management decisions in labor. So your equipment will come as part of a preset kit for fetal scalp sampling. This is a amniscope and an obturator, and this purple part is a small light that's inserted. So you start by making sure the light is inserted, the obturator is inserted, and you insert the amniscope into the vagina and onto the presenting part. So you need to make sure that your cervix is dilated enough that the amniscope can pass through it and that the membranes are ruptured. You also need to make sure you know what your fetal part is that's presenting because you don't want to traumatize more sensitive tissue like eyes or genital areas. So once your amniscope is inserted, you can remove your obturator and the light will automatically go on. And you can then leave that in the vagina to set up your visual field for where you will be taking your scalp sample from. So the first thing you'll do is you'll clean the area. So swab away, you need to make sure that any blood, membranes are all cleaned away so that you have a clean surface from which to take your sample. And you'll start by adding a very thin layer of Vaseline over the area that you're going to be taking your sample from. And usually this Vaseline will actually come in the kit as a little bit of gel that you can use. Once you're ready to take your swab, you're going to take your instrument. So this instrument has a blade right at the very tip here. And it also has a capillary pipelle so that you can collect your sample. So you're going to enter in through the amniscope without your blade in position, and once you're in, you can put out your blade and then just do a small puncture on the baby's scalp. Once you've done your puncture, you can push this button and that will retract the blade, and then you'll just gently touch the puncture spot and the blood that's coming from it with the capillary tube, and the blood will get sucked into the tube. And usually most of the tube will fill. You need between 5 to 50 microliters for a sample. Once you've done that, you take the capillary tube off, you put a red cap on the side that touched the fetal scalp, you put a magnetic bar into the sample, which will help to keep it mixed, and then you put a white cap on the other end. And then this, you want to continually keep moving and shaking until you've delivered the sample to the lab. The kit will also give you a tool to do 2 more samples, so you can do a total of 3 samples. Once you've completed doing your samples, you're going to again use a sterile swab to put some pressure on the point where you punctured, just to make sure that you've achieved hemostasis. You're going to visualize through your amniscope again the fetal scalp to make sure that it looks okay and that there isn't too much bleeding. And then you can remove the amniscope and await the results of your test. Contraindications, so you would not do this type of sampling, or you would be reticent to, certainly if you had a placenta previa, if there were active infection, especially genital infections, or if you weren't confident about what the presenting part was.